Ryan Shelton. I'm with My Go-To Doc. Thanks for joining me. Happy Tuesday. I am very sorry. My sincere apologies for missing last week. I was actually exposed to COVID and I was out for about 5 or 6 days. So my apologies. I'm not 100%, but I'm feeling well enough to talk about today's topic, which is on Lyme's disease. So 2 weeks ago was on mold toxicity. Last week was supposed to be on Lyme's disease, but we've moved that to this week. Next week will be on fibromyalgia. Now, you may ask, why are we talking from a functional medicine standpoint about these other conditions besides long COVID? And the reason is they share many similar characteristics as long haul COVID does. They share many symptoms. Many of the labs are similar as well. So today's topic, while it's not directly related to long haul COVID, Lyme's disease is important because it can mirror a lot of the symptoms of long haul COVID. And being exposed to COVID, having long haul COVID, can actually make you more susceptible to Lyme's disease. And in fact, perhaps the bacteria has been living with you for a while. And long haul COVID has a way of bringing up old viruses, bringing up old bacteria. And so they're not exactly the same. They share many similarities, but they are related because post COVID, you can experience a flare of Lyme's disease. So I think it's an important topic to talk about from the standpoint of functional medicine. So we'll cover just the basics for about 20 minutes or so, and then I certainly want to open the field up to any questions that you might have about Lyme's disease. I've treated a few hundred patients with Lyme's disease. I cannot consider myself an expert, but I work with colleagues who are, and we've developed some pretty thorough, effective protocols for treating Lyme's disease. So Lyme's disease is a multi-system infection caused by a spirochete bacteria called Borrelia. Now, that sentence right there shares many similarities to long haul COVID. It's a multi-system infection. It's not just infecting the respiratory system or the integumentary system, the skin. It's a multi-system infection caused by this bacteria. And of course, the bacteria ultimately is derived from deer ticks or black-legged ticks. And it was first really noted around 1977 or so. Now, currently, uh, over 400,000 cases per year are diagnosed and reported. It occurs in the United States. It occurs mostly in the Northeast, the upper Midwest. It certainly is prevalent in European countries as well. So there are different stages of Lyme's disease. First, there's an early localized, then there's an early disseminated, and then there's the late chronic Lyme's disease. In the early localized, really the main symptom, the first symptom that is typically discovered is a skin rash. It's called erythema migrans. And it's often colloquially described as a bullseye rash. So it looks like a bullseye on the skin as a result of the original or initial tick bite. Early symptoms can also include myalgia, so muscle pain, arthralgia, which is joint pain, fatigue, headache, flu-like symptoms such as fever and malaise. Fatigue is big. Brain fog is a big symptom as well. Now, that's the early localized. About 3 to 5 weeks later, we can start to see symptoms develop in the second phase of Lyme's disease, the early disseminated phase of Lyme's disease, which can expand on the original symptoms. The original symptoms may not go away. You may still have muscle pain and joint pain and fatigue and headache and fever, but we really start to see differences in the nervous system. So brain fog can be significant, difficulty concentration. We can have neuropathies or paresthesias with tingling in the hands and feet. We can have nerve pain as well. The fatigue becomes more pronounced, and flu-like symptoms can become more pronounced as well. And then that can last anywhere from just a few weeks to several months. And then we start to get into the late chronic stage of Lyme's disease. Again, all of the original symptoms of stage one and stage two can still be present, and they can become more debilitating and more severe. And we can also begin to see other systems affected. So, mood can be affected, depression, anxiety. We can start to see the brain fog really become debilitating. The cardiovascular system and the GI system can become affected at this point. So, the late chronic can last anywhere from several months to several years, especially if the original infection, the early localized, was not aggressively treated with either the standard antibiotic protocol or natural treatments. So, the standard protocol it varies from doctor to doctor, but antibiotics tend to be, because it is a bacterium, antibiotics tend to be the first line treatment. And unfortunately, it only seems to work in about 40% of patients, even with the aggressive three antibiotic protocol. Self-diagnosis is very common. So people suspect Lyme's disease. They see a bullseye rash on their skin. Perhaps they even saw the initial tick and was able to identify that and pull that off. They go through checklists online and tick off the number of symptoms that they may be experiencing. And so a lot of times patients are self-diagnosed, and they go into their doctor and say, I really suspect that I have Lyme's disease. So the first line diagnosis is to look for antibodies. Both IgM and IgG antibodies are very important. IgM usually starts to occur in the earlier phases, and IgG in the second and third phases. And these antibody tests are either ELISA tests. ELISA, unfortunately, has many false positives, PCR tests, which are a little more accurate. And these always have to be confirmed with a second line testing called Western blot. So, Western blot confirmation is very important because there are so many false positives with these ELISA tests. Uh, there can be other diagnostic workups as well, a CBC, a comprehensive metabolic panel. And we unfortunately see a lot of those pro inflammatory markers that we do with COVID, that we do with chronic fatigue, that we do with fibromyalgia. So, inflammatory markers, GI disruption, changes in GI enzymes, microclotting. So, we need to look at fibrinogen levels. Nutrient deficiencies begin to occur: vitamin A, copper, zinc, magnesium, and others. So the diagnostic gold standard is to get those IgM, IgG antibodies, and there are a number of lab companies out there that perform the ELISA test, the PCR, but it is important to get that confirmation through Western blot. Now, the standard treatment is the use of three antibiotics. It typically is doxycycline at a dose of 100 milligrams twice a day, amoxicillin at a dose of 500 milligrams three times a day, and cefuroxamine at a dose of 500 milligrams twice a day. This regimen in the early localized stage for 14 days. And of course, over the counter NSAIDs can be helpful if you enter the second stage and begin to experience neuropathies and nervous system disruption. Gabapentin is often prescribed at 300 milligrams per day. There are many natural treatments as well that have been studied for Lyme's disease, and I'll just list them off here. Acetyl L-carnitine, alpha lipoic acid, fish oil. The fish oil has to be performed at pretty high doses, around 3 to 5,000 milligrams per day. Ginkgo has been looked at. Probiotics, a few strains in particular, might be helpful because the bacteria, the Borrelia, does some major damage to your microbiome, and so replenishing that microbiome with certain probiotics can be quite helpful, especially for GI symptoms, because Borrelia can be quite disruptive to the GI tract. So that's KCI, Paracaceae, Plantarum, and Acidophilus, all lactobacillus species. And then certain herbs have been looked at as well. Artemisia, berberine, so berberine is an extract from a plant, from several plants. Hydrastis would be one example. Cat's claw seems to have some pretty good effect. Black walnut, Chinese skullcap, Japanese knotwood, uh, Ghana quinine seems to have some pretty decent effect. And then high dose resveratrol, and I'm talking maybe a minimum of 100 milligrams per day. Of course, it causes inflammation throughout the body, Lyme's disease. And so focusing on an anti-inflammatory diet, whole foods, nutrient dense, getting out the refined foods, the processed foods, the sugars, getting out the red meat oftentimes can be helpful as well. Staying physically active, so therapeutic movement, exercise to tolerance. A lot of Lyme's disease patients feel pretty wiped out, and so it's important to continue to move. Sleep is disrupted, so your energy levels are in the basement. It's important to continue to move, but just to tolerance. You should feel a little a little better, a little more energized after you move, rather than feeling completely wiped out. And so, for therapeutic movements, I like things like Tai Chi and Qigong and yoga. Those are all excellent. I certainly wouldn't push you to go to a gym and exercise with a lot of resistance training, or going for jogging. I think that's too excessive for a lot of patients. IV Myers cocktail, I've mentioned it before, for COVID and for chronic disease, has been pretty effective at relieving some of the symptoms for patients. So Myers cocktail, and that has to be taken as an IV. And then, of course, the mind body relationship, making sure that your stress is under control, engaging in stress reducing techniques such as deep breathing exercise, meditation. You can take adaptogenic herbs, which can be helpful, but making sure that your stress is under control, because that can really exacerbate any of the symptoms. And then there is one therapeutic agent. It's actually a bacteria, believe it or not, derived from soil, but it's in its initial stages of investigation. It's called hygromycin A. Hygromycin A, and it does really seem to help people in the early trials. So that's kind of something that is on the horizon, and something that's been used by doctors treating Lyme's disease. That as well is an injection. It's certainly not utilized as an oral medication, but that's something that looks like it has some promise for us. So that's my quick review of Lyme's disease. I'm going to see if I have any questions that you all might have for me. Let's see. I am very concerned about ticks. Yes. We live in the countryside, and just yesterday I picked up a tiny tick from my son's eyebrow. I was gentle and pulled it off with tweezers. Then I studied it under a magnifying glass. I could see all the parts, including the head. That's great. Oftentimes, when you remove a tick, the head is just lodged and it actually remains embedded in the skin. So seeing the head is very good. Excuse me. As such, I never took him to the hospital. He seems absolutely fine today. That's great. Should I have rushed him to the hospital? Not necessarily. It's one. It's actually, it's mostly one species of tick that causes Lyme's disease. There's another that rarely does. It's a black-legged tick. It tends to have some black markings on its back, but you would certainly have to look under a microscope to understand that. If he seems absolutely fine today and no symptoms, I'm not sure how long ago the tick was removed or when he was bitten. Um, if he seems fine today, I don't believe there's any reason to rush him off to the hospital. Just be mindful and aware and present of any developing flu-like symptoms, fatigue. He's complaining of achy joints, achy muscles, headaches, just feeling off. His sleep might be disrupted. If those start to develop, certainly take him to a healthcare provider and get those antibody tests. And certainly in the early stages, the IgM antibodies would be the first to show up against the Borrelia bacteria. Again, IgG tends to be developing about 5 to 8 weeks after the initial tick bite. So be watchful, and if he seems to develop any of these symptoms at that point, take him to a healthcare provider, get some labs done, and if those lab tests come back positive, then certainly initiating that triple antibiotic therapy can be useful. And anytime that you take antibiotic protocol, make sure that you're replenishing with good high quality of probiotic. I recommend that for every day that you're on an antibiotic, and that three antibiotic regimen, it's going to completely wipe out his microbiome. So for every day that you're on an antibiotic, take a probiotic for double the amount of time. So if the protocol is 14 days, we're looking at a minimum of a month of taking a high dose multi-strain probiotic. Sorry, I'm still trying to still hydrate it. Can the vaccine activate Lyme? Yes, it can. The vaccine can activate Lyme if you've had latent Lyme that maybe was well treated months or years ago. Unfortunately, the vaccine can reactivate the bacteria, Borrelia. Let's see. My mom has no Lyme symptoms, but she did have two Moderna boosters, and she underwent extensive testing at my advice. She came out positive to Lyme. The only thing she complains about is dizziness. It can be pretty severe. So I would certainly want to make sure that you confirm that positive test. Likely it was ELISA or PCR. Confirm that positive test with a Western blot, because that's the true confirmation that yes, Borrelia antibodies are being produced. If dizziness is the only symptoms or the only symptom that she's experiencing, you might want to consider initiating some of these natural treatments first before the antibiotics. Certainly get probiotics on board: Artemisia, berberine, cat's claw, Chinese skullcap, black walnut, resveratrol, getting these on board right away, so that you're not waiting around to see what else develops. And certainly, if dizziness is the primary symptom, ginkgo is worth a try. Probably around 600 milligrams per day to try that. Hopefully, I answered your question. Let's see, next one. Ticks on my dog. I've never seen one, but he's allowed outside daily. Now I wonder, will a potential tick lay eggs in my house? Uh, Anything's possible. And again, it's not it's not the species. So a dog tick is not the species that would typically cause Lyme's disease. It is a deer tick, and so uh, you're more likely to be exposed to deer ticks, say going on a walk, going on a hike, out in the woods. They're just hanging out on grass or on leaves that have rubbed off from a deer, and then you're exposed and you're bitten. But the ticks that tend to bite on dogs uh, is not the species that tends to cause Lyme's disease. Okay, let's see if there's any more other questions here. I'm not seeing any. So I'll give it another minute or two to see if anyone else has questions. Testing is very important. Getting aggressive treatment on board is really important because the second and certainly the third stage, where it starts to affect heart health and the cardiovascular system, the neurological system, your mood. Those are much more difficult to treat. And even though only about 40% of patients uh, are completely cured or remedied by that triple antibiotic therapy, it's still 40%, and that's a decent um, number to consider, at least in my book, to try to prevent some of those more debilitating and severe symptoms that can develop weeks or months down the road. And the initial symptoms can also go away. You may feel fine. You may get the triple antibiotic treatment and feel fine for 2 or 3 months, and then start suddenly some of these second stage symptoms can start to develop. Again, it's only 40% is that triple antibiotic therapy completely effective. And so it may be a few months before you start to see other symptoms develop. So that's something to be mindful of. And going back to the mind body relationship, as with chronic fatigue, as with long haul COVID, it's very important to activate the parasympathetic nervous system because at this point your sympathetic nervous system is hyperactive. It's in the alarm stage. It's fight or flight. It's causing fatigue during the day and poor sleep at night. It's causing dysregulation of your immune system, and making sure that you really stimulate your parasympathetic nervous system through deep breathing, meditation. I love contrast hydrotherapy. I think that's a wonderful technique. Cold plunges can be wonderful for those of you brave enough. And the cold with contrast hydrotherapy does not have to be long in duration. We're talking 30 to 60 seconds. And the same is true of a cold plunge. Just jumping in cold water or taking a cold bath for 30 or 60 seconds can really stimulate the parasympathetic nervous system. And then, certainly, as I stated before, consider taking some adaptogens as well. I think another question came in here. Yes, is Lyme's curable? Absolutely, it's curable. And as with any chronic disease, the earlier, I'm sorry, I should have silenced my phone. The earlier and more aggressive with the treatment, the better chance that you can be cured of Lyme's disease. Because once you enter the third stage, it becomes very difficult to cure. It can take months and months to see complete resolution of symptoms. And then here's a case where, let's say you enter the third stage and you engage in a functional medicine protocol where you're doing your best to completely eradicate the symptoms, and they do go away. Great. And then maybe 6 or 9 months later, you're exposed to COVID. You get COVID, which maybe is just an acute phase that lasts 6 to 8 days, and then suddenly, a few weeks after that, you get this reactivation of Lyme's disease. So that's pretty typical. I've seen that quite often. But yes, it is curable, and the earlier and more aggressive that you initiate treatment, the more likely it is that you'll prevent entering the second and third stages. Um, Hopefully that answered your question. Okay, I'm not seeing much else at this point. No more questions. I'm not sure how many of individuals joined today. I never see a number. So again, my apologies for last week. I was out sick. Next week, the topic is going to be fibromyalgia. So tell your friends. Make sure that you join us as well. Next Tuesday, same time. The topic will be fibromyalgia. So I enjoy my time with you each and every week. Hopefully you learn something. That's the whole point of this. And next week, fibromyalgia. So have a great week, everyone. Take care and goodbye.